A cancer diagnosis can be a difficult time for everyone involved. We want your first visit at the Cancer Center to be as stress-free as possible. This guide will help answer questions like what you need to bring, where to park, what services are available, and will give you other useful information. We at William Osler want to provide you with the best care possible. We encourage you to ask your healthcare team any questions you may have and take advantage of available supports and classes so we can work together to achieve this goal. The William Osler Health System Oncology team is dedicated to providing the best cancer care possible. As a member of the Mississauga-Halton Central West Regional Cancer Program and in partnership with Cancer Care Ontario, we strive to provide exceptional, compassionate care for people impacted by cancer. Together, we aim to support the whole person by working together to deliver patient-centered care that addresses the physical, mental, and social needs of patients and caregivers. Work with our partners to provide seamless care transitions along the cancer care journey. Incorporate the voice of people impacted by cancer to deliver the best possible experience and provide patients with timely access to high-quality care. Your cancer care team is the group of healthcare professionals who treat your physical and emotional health when you have cancer. Your treatment team may include the oncologist, a physician who specializes in cancer care. After a cancer diagnosis is made, the oncologist will explain to you what this means. They will discuss the disease stage, provide various treatment options, and with your input, will determine the best course of treatment tailored for you. The oncology nurse practitioner is specially trained to focus on subpopulation with cancer care with an emphasis on prevention, screening, counseling, and psychosocial care. Oncology nurses are trained specialists in cancer care. They have completed additional education and are certified experts in chemotherapy administration and side effect management. Our nursing team can support and/or refer you to help with your physical, emotional, and psychological well-being. The immunotherapy nurse is a specialized oncology nurse who is competent and has the knowledge in immunotherapy, mechanism of action, administration principles, toxicity, adverse reactions, and nursing assessment and management. The oncology pharmacists work as part of your healthcare team to prepare the chemotherapy and ensure that it is both safe and effective. The pharmacist will meet with you to provide information about your specific chemotherapy regimen, including possible side effects and management and prevention strategies. The pharmacist will review your medications to determine if they have any effects on the chemotherapy you will be receiving and can also provide you with information on natural health products. The social worker helps patients cope with the many practical and emotional needs they may have during their cancer journey. Some of the problems that they can help with include feelings of distress, trouble sleeping, low mood, financial concerns, and contacting other resources in the community. The dietitian is a healthcare professional who assesses your diet and nutritional needs and can offer you information on healthy eating during cancer treatment. They can help you manage treatment-related side effects that may affect your ability to eat well and provide you with information on the use of natural health products and oral nutrition supplements. Our clerical associates are vital to the day-to-day functioning of the oncology clinic. They are present throughout all stages of the process and ensure patients receive safe and timely access to all services required throughout the continuum of care. Some examples include registration on the day of your appointment, booking future appointments, inputting physician orders, and general support of the team. And you. You are an important part of the team. Your input and the information that you provide is very valuable and can help ensure that we provide the highest quality of care possible. Please do not hesitate to provide any feedback throughout your cancer care journey. You know how you are feeling, and we know how to help. Your Symptoms Matter is a standardized screening tool that helps you tell your healthcare team how you are feeling on that day. It will also help you and your healthcare team keep track of the changes in your health over time. Please complete your symptom screening at each of your appointments. How to complete your symptom screen. Use a touchscreen tablet or computer terminal. Log in with your Ontario Health Card number. Rate your symptoms on a scale of 0 to 10 based on how you feel today. Rate your ability to be active over the last month. Give your report to your nurse. Do not put it away until you have seen your nurse. What happens next? Your healthcare team will review your scores and provide you with personalized support. Please tell us about any symptoms you have that are not part of the Your Symptoms Matter survey. Take your printout home, share it with your family doctor or other healthcare providers you see. What will happen on the day of treatment? Your first day of treatment may be long and tiring. There are a lot of new people to meet and a lot of information that will be reviewed with you. In addition, you'll receive written instructions to take home, explaining how to manage the possible side effects related to the chemotherapy. You may also receive prescriptions for medications that will help reduce or manage possible side effects. Our chemotherapy staff will support you throughout your treatment so you know what to expect before, during, and after each cycle of chemotherapy. This section will explain the steps you will go through on the day of your treatment. Step 1. Arrive prepared. Please ensure that you check your appointment card prior to every visit. Bring any medications you take during the day with you. This includes over-the-counter and herbal medications. Eat a light breakfast. Be prepared for a long day with some waiting between steps. Bring a snack or lunch or beverage, or these may be bought at the on-site cafeteria prior to treatment. A microwave oven is available in the clinic. Wear comfortable clothes with sleeves that can be easily raised to have your blood taken and an IV inserted. You may bring one family member or friend into the chemotherapy suite. It is helpful to have someone with you to support you and collect all of the information you will receive. Please be aware that pregnant women and children are not recommended to attend your chemotherapy appointment. It is a good idea to have backup childcare arranged in case of any delays. Please do not book any other appointments on days you have chemotherapy. Bring books, puzzles, iPads, or any other quiet activities you might enjoy. Please do not wear perfume or cologne. Osler is a scent-free environment. Your first day of visit may include blood work, doctor or nurse visit. Please have your OHIP card with you. You will be required to register at the kiosk with your OHIP. You will receive a printout of a ticket with registration number and directions to the clinic. Step 2. When you arrive. All patients must register at the kiosk at entrance B prior to entering the clinic and receiving care. Please use the Sun elevators located at entrance B to get to the Ambulatory Oncology clinic on the 5th level. If you require blood work, you will be asked to wait in the waiting room for a blood collection nurse. You will need to complete the Your Symptoms Matter screening tool at the kiosk prior to registration. This is an important tool that helps your treatment team understand more about how you are feeling throughout the course of treatment. This should be done each time you visit the clinic. Please see page 8 for more details. It may be beneficial to keep a record of your symptoms so that you can provide this to the team and update the Your Symptoms Matter survey accurately. If you are having chemotherapy on the same day as your blood work, please return to the waiting room after your blood is drawn. Please be patient, as this process may take some time. Step 3. Before your chemotherapy, please let the nurse know if you are feeling unwell. This could include symptoms such as fever, cough, or pain. Please also feel free to discuss any other questions or symptoms from the last treatment with your nurse. The nurses will check your blood work results and make sure that you are safe to proceed with treatment. Your height and weight will be checked on your first day and may be checked frequently throughout your course of treatment. Step 4. The pharmacy prepares your chemotherapy. Each individual chemotherapy order must be prepared by the pharmacy on the day of treatment and will only be prepared once the oncologist has written the order for you to proceed with treatment on that date. This may take some time, so please be prepared to wait. You may need to take some medication to help you with nausea before you start chemotherapy. Please bring it with you and ask your nurse if it is necessary. Bring your drug insurance information and money for any needed prescriptions. If you do not have drug insurance, ask to be connected to a drug access facilitator. Step 5. At the time of your chemotherapy, you'll be brought into a room with comfortable chairs or beds, depending on the type and length of your treatment. An intravenous line will be inserted into your vein. If a PICC, portacath, or Hickman catheter are required, a procedure will be scheduled prior to treatment for this. The chemotherapy will be given through this line. The nurse will teach you about the chemotherapy you will be receiving, the possible side effects, and answer any questions you may have. Medication may be given by mouth or intravenously before the chemotherapy to prevent side effects. The nurse will check on you frequently to make sure you are not having any reactions from the drugs. Please notify the nurse if you feel anything unusual or if you have any concerns. Depending on what treatment you are receiving, the nurse and other treatment team members may need to check your blood pressure, heart rate, or temperature regularly. Do not be alarmed and feel free to ask if you have any questions regarding your treatment. A pharmacist will speak with you about any chemotherapy and anti-nausea pills that you take at home with you and their side effects. The pharmacist can also offer suggestions on how to deal with the side effects and will also answer the questions that you may have. You can watch television, read, eat, or just relax while your treatment is being given. If you need to get up, the nurse can unplug the IV pole from the wall to allow you to do so. Other members of the treatment team may be available to address any specific questions or concerns. Step 6. All finished. Your intravenous line may be removed. However, in some cases, the chemotherapy regimen will require it to remain in place so that treatment can continue at home. Your nurse may provide you with specific instructions to follow or with education related to your treatment. Once you return home, you can call your nursing phone line during clinic hours with any questions or concerns you may have. We do not provide copies of blood work results or information that can be obtained on MyChart. Please speak to a clerical associate for more information or register online at www.mychart.ca. Please be advised a thorough physical exam, including private or sensitive areas, may occur as part of the visit process. You may request to have a staff member accompany you for the examination and/or an interpreter at every visit. Who do I call with concerns? The oncology clinic hours are from Monday to Friday from 8 a.m. until 4:30 p.m., where the oncology nurses work from 8:30 a.m. until 4:30 p.m. You can contact Osler's main switchboard 905-494-2120 or the direct line to the oncology clinic 905-494-6542. Please see the phone extensions on the current slide for each of the oncologist's designated nurses as well as the resource nurse. If you need urgent medical attention, such as if your fever is higher than 38.3 degrees Celsius or more, if you have nausea or vomiting or diarrhea that will not stop, go to the nearest emergency department. Make sure to bring your current medications, your fever card, and treatment description with you. During clinic hours, please call your nursing line at the extension provided to you. For non-urgent matters, please feel free to leave a message with your nurse or go to your family doctor. William Osler Health System, in partnership with CareChart at Home and Cancer Care Ontario, have developed an after-hours telephone service to support you in managing your cancer-related treatment symptoms. The goal of the after-hours symptom management telephone line is to help you better manage your symptoms at home, preventing you from needing to visit the emergency room. Please call 1-877-681-3057. An operator will answer your call and forward your call to a specialized oncology nurse that can assist you. If the nurse is not immediately available, the nurse will call you back within 15 minutes. At your education session, additional information will be provided to you regarding this useful tool. What is the Oncology Urgent Clinic? The Oncology Urgent Clinic provides support to cancer patients at William Osler who are having symptoms from their cancer or side effects from their cancer treatment. The goal of the clinic is to reduce the number of visits to the emergency department and admissions to the hospital. The clinic is led by a nurse practitioner who has specialized oncology training. How do I access the Oncology Urgent Clinic? The Oncology Urgent Clinic does not accept drop-in patients. In order to access the Oncology Urgent Clinic, you must be referred by the oncology team, such as your doctor or your nurse. If you have a symptom or concern about your cancer, please call your oncology nurse and they will help you decide the best course of action. The nurse will make a referral for you to visit the oncology urgent clinic if it is required. You are assigned a primary oncologist and a nurse. The nurses are available by telephone Monday to Friday from 8:30 a.m. until 4:30 p.m. Please leave a message and we will get back to you within 24 hours. After clinic hours and on weekends, if you need to speak to a nurse, please call our after hours symptom management line at 1-877 681 3057. The oncology team members are listed on the Oncology Services pamphlet. Please talk to your nurse if you need to see any of them. What is chemotherapy? Chemotherapy is the treatment of cancer with drugs. When is chemotherapy used? Chemotherapy may be used alone or together with other forms of treatment, such as surgery or radiation therapy. Chemotherapy can be used to cure cancer in some cases. Chemotherapy helps to slow down cancer growth. Chemotherapy can also reduce symptoms of cancer. Adjuvant chemotherapy refers to medicines that are administered after surgery for the treatment of cancer. Adjuvant chemotherapy is designed to prevent the recurrence of the disease. Cancer cells divide and multiply in an uncontrolled way. Chemotherapy affects the ability of cancer cells to grow and divide. Chemotherapy can destroy cancer cells or stop them from growing and may also affect your healthy cells. How long is each chemotherapy treatment? The treatment time will vary depending on the type of drugs you receive. The time can range from 10 minutes to 6 hours. How is chemotherapy given? The way you receive your chemotherapy will depend on the kind that is prescribed for you. You may receive chemotherapy as an outpatient in the clinic, or in some cases, you may be admitted to the hospital. Chemotherapy is given orally, by mouth as a tablet or capsule, intravenously through IV pick or port, subcutaneously by needle injection under the skin or into the muscle. How long is each chemotherapy treatment? The treatment time will vary depending on the type of drugs you receive. The time can range from 10 minutes to 6 hours. How is chemotherapy given? The way you receive your chemotherapy will depend on the kind that is prescribed for you. You may receive chemotherapy as an outpatient in the clinic, or in some cases, you may be admitted to the hospital. Chemotherapy is given orally, by mouth as a tablet or capsule, intravenously through IV pick or port, subcutaneously by needle injection under the skin or into the muscle. Chemotherapy treatments fight the cancer cells in your body. Sometimes the chemotherapy can harm normal healthy cells as well as cause side effects. Not everyone will experience the side effects, and side effects are almost always temporary. People receiving the same chemotherapy treatments may not experience side effects in the same way. This section will explain the common side effects of chemotherapy and provide suggestions for helping you manage them. Specific side effects depend on the type of cancer being treated, the length of the treatment, how much chemotherapy is being given, for example, the dose, and the type of chemotherapy that is being used. Nausea and vomiting. Nausea is when you feel queasy or sick to your stomach. Vomiting is when you throw up. Nausea and vomiting symptoms may begin within hours of the chemotherapy drugs are given and may last for several days. Not everyone will experience nausea and or vomiting. Nausea and vomiting can be caused by your chemotherapy treatment, your cancer, and constipation. How to manage nausea and vomiting after chemotherapy. Take your medications for nausea and vomiting exactly as directed by your medical oncologist. Do not wait for nausea to get worse before taking your medication. Phone your oncologist, nurse, or pharmacist if nausea is severe and lasts longer than 48 hours, your nausea pills are not working, or if you have vomited several times in that day. Remember to drink fluids often and eat small amounts every 2 to 3 hours throughout the day. Avoid hot, fatty, or spicy foods. If the smell of certain foods makes you feel sick to your stomach, try to have someone else cook the meal or eat the food cold. After eating, relax, but do not lie down flat. Fatigue is described as more than feeling tired. The feeling of fatigue does not go away after a rest or a good night's sleep. Some of the signs of fatigue you may experience include getting tired quickly from doing normal things like taking a shower, cooking, going for a walk, climbing stairs, or having difficulty with your concentration or memory. In many cases, fatigue may be present due to multiple factors. These include the cancer itself, the chemotherapy or treatment protocol, or psychosocial factors. If you feel you are experiencing fatigue, please share this with a member of your cancer healthcare team. Loss of appetite. You may not feel like eating for a few days after chemotherapy. If you can, try to eat small amounts of food, as this can ease some of your side effects and give you energy. This is especially important if you have diabetes. Consider adding spices for flavor if your tastes have changed. Make every bite count and drink fluids that provide you with calories and protein, like milk, soy beverages, smoothies, and liquid nutritionals such as Onshore or Boost. You can meet with a registered dietitian if you're experiencing any nutrition problems or if you have questions or concerns about your diet. Additionally, please review the What to Eat booklet available in the clinic. Please speak to your oncologist about a referral to a registered dietitian. Soreness or discomfort in the mouth. The cells that line your mouth and throat can be damaged by the chemotherapy and can make eating difficult. Chemotherapy can cause dryness or soreness in the mouth, tongue, or throat, or mouth sores, and can lead to infection in the gums, mouth, or throat. There are strategies available to help prevent and soothe such symptoms. Please refer to page 30 to 34 of the pamphlet or ask your nurse for details. Chemotherapy can have an irritating effect on the stomach. If you have a history of ulcer or problems with acid or heartburn, discuss your concerns with your primary nurse or oncologist. Inform your doctor or primary nurse if you are suffering from indigestion, heartburn, gas, or stomach pain. Management strategies can include limiting hot, spicy, and acidic foods, such as tomatoes or citrus fruits, caffeine, alcohol, and tobacco, as they can worsen the problem. Discuss medication options with your oncologist or pharmacist. Change in bowel habits. Both constipation, so difficulty having a bowel movement, and diarrhea, loose, watery stools that occur 3 or more times a day, can be side effects of certain chemotherapy drugs. Both should be discussed with your oncologist or primary nurse if these persist for more than a few days. For many people with cancer, they wonder how cancer and treatment might affect their ability to have and enjoy sex. They want to find ways to make sure they can have the kind of sex life they want during and after treatment. Having cancer can raise many new questions about safety in sex. It depends on what your treatment is. Hugging and cuddling with your partner is almost always okay, but ask your doctor if there are times when you should not have sex and what you should do to protect your partner and yourself when you do. For example, your doctor may advise you to avoid having sex with penetration for a few weeks after surgery or if you're at risk of bleeding or catching an infection. Your doctor may tell you to use a condom or other barrier for a number of days after chemo to protect your partner from drugs that can get into the semen or vaginal fluids. Sexual changes are different for men and women. Please speak to your doctor or nurse for more information. Avoid getting pregnant or getting someone pregnant while you're being treated for cancer. The treatment you need may harm the baby. Talk to your doctor about what kind of birth control to use during treatment. If you think you would like to have a child in the future, talk to your healthcare team before you start treatment. Treatment could affect your ability to get pregnant or get someone else pregnant. Your doctor may decide to treat your cancer by immunotherapy alone or a combination of immunotherapy and chemotherapy. Immunotherapy is a type of treatment that works by using your body's own natural defenses to fight against cancer cells. In cancer treatment, the boosting enables your immune system to better recognize and attack cancer cells. Immunotherapy is currently being used as a treatment in a wide range of different cancers. Once your treatment is confirmed, you'll be referred to immunotherapy clinic and specialized nurse will teach you all about the treatment, possible side effects, how to report and communicate with your healthcare team. Side effects on immunotherapy. Sometimes immunotherapy can cause your immune system to damage your healthy cells by mistake. Because of this, potential side effects may arise in different parts of the body. Common side effects include inflammation of the lungs, pneumonitis, inflammation of the intestines, colitis, and inflammation of the skin, dermatitis. Most symptoms that are listed above may be treated with medicines called steroids or with hormone replacement therapy. It's very important to tell your healthcare team about any side effects or changes to your health as soon as they appear rather than trying to manage them yourself. Oral anti-cancer therapy is when cancer treatment is taken by mouth. It can be a tablet, a capsule, or a liquid. Majority of cancer treatments are injected into the body, but sometimes an oral treatment is used either alone or in combination with injectable chemotherapy. Oral anti-cancer therapy can be picked up from your pharmacy and taken at home. You do not need to come to the oncology clinic for each dose. Your oncologist comes up with your treatment plan based on the type of cancer you have and other factors. Talk to your pharmacist about how you can safely take your oral anti-cancer therapy at home. Conventional therapies are treatment options that are widely accepted and used to treat people in the Canadian healthcare system. Conventional cancer treatments such as surgery, chemotherapy, immunotherapy, and radiation focus on eliminating and/or restricting the cancer's ability to grow and spread. Complementary therapies can be used to ease symptoms and improve feelings of overall health and well-being. The purpose of complementary therapy is to help a person cope with cancer, feel better, and/or reduce the side effects of treatment rather than treat the cancer itself. They are used together with conventional therapies as part of a holistic approach which aims to treat the person as a whole. Alternative therapies are those used in place of conventional treatments. They are considered scientifically unproven therapies. Is there a difference between complementary and alternative therapies? Yes, there is. They mean something very different. While complementary therapies are used together with conventional therapies, alternative therapies are used instead of conventional therapies. For more information, see complementary therapies or living with cancer resource booklets available in the oncology clinic. Always discuss with your doctor before using either alternative or complementary therapy. This concludes our presentation. Thank you so much for your attentiveness. You can reference the pamphlets and speak to the healthcare team regarding any outstanding questions you may have. We will be there to support you along your cancer journey. Take care.